Oi, 7:10.
Good evening, everyone. It's already 7:50. So I'm Amrita, a PhD student at University of Hyderabad, and start the class. If anyone is new to the class, so this is week 2 for the It's maternal infant child nutrition, and we have discussed already previous year questions or assignment questions for week 1, and today we will be discussing for week 2. Okay, so whoever has joined first, they can they can through the recording of week 1, which is available YouTube channel. Okay, I hope you all got access to the YouTube channel video for week 1. I guess the details were provided to you. Okay, you can check in the NPTEL website. It is available. Okay, to give any details here, you can go to the NPTEL website where you are taking the assignments, current year assignments. There only one option is there called announcements. There you can find all the details. Okay, so anyone who has missed week 1, they can go through the recording of week 1. Okay, but it is always good attend the live class and answer with me here. Okay, so the rule is everyone's audio and video will be mute. All have to answer each question through the chat box. Okay, so there will be a question along with four options or two options, and you have to write what according to you is the correct answer in the chat box. I will be seeing the answers, and at last we will discuss what is your score out of 22 questions are there. So out of 22, how many wrong answers and how many correct answers you are giving. Okay, so yeah, let's start. The first question: Dash are the richest sources of vitamin A. Oats, brain and heart, oat and chicken liver, papaya and carrots, spinach and fenugreek leaves. Start answering. So sorry, I just without sharing the screen I started. So sorry. Yeah, I hope it is visible now. I'm happy that many of you have joined on time today. I was a bit late. I'm really sorry for that. But yeah, everyone, please keep your audio mute. Alright. Okay. Let's see what is the answer to no screen sharing yet. Is there anyone who can't see the screen? I have already shared the screen. Is it visible to everyone? Some people are saying no, some people are saying yes. Whoever is saying no, please exit the class and join again. Okay? I think majority are saying yes. So I think it is visible. From my side, I don't have any network issues. If you have any, then smaller screen. I guess it's visible. Okay, let's see what is the answer for the first question. It is B. Goat and chicken liver. I think most of you are correct. So, goat and chicken liver are the best sources of vitamin A. They have a great source of EPA and HTA. They contain all the vitamins, and they are also, along with vitamin A, they are also rich in vitamin B12. Along with they have they contain some amount of trace minerals as well as iron. Okay. Okay. Moving on to the next question. What are antioxidants? Substances that protect our body from damage by free radicals. Substances that do not protect us from free radicals. Substances that cause damage to our body. Substances that produce free radicals. Questions are a bit easy this time compared to week 1. So I guess everyone should get full marks this time, right? So okay, let's see what is the answer to the second question, right? It is A. Substances that protect our body from damage by free radicals. So, how do antioxidants work? Here you can see they protect our body from the free radicals which damage our cells. So, what kind of how these free radicals get generated? They get generated by stress, toxins, chemicals, and radiation as well. And how the antioxidants protect us from all these factors? They neutralize these radicals, right? That's why it is always suggested that we eat foods which are rich in antioxidants, right? Moving on to the next, a dash nutrient deficiency is commonly diagnosed in two ways. First, the unique symptoms of deficiency are recognized, then, the level of the nutrient in the body is measured by a blood test. Type 1, type 2. Okay. Okay, let's see what is the correct answer. Correct answer is A. So, the type 1 nutrient deficiency is commonly diagnosed in two ways. First, the unique symptoms of the deficiency are recognized, then, the level of the nutrient in the body is measured by a blood test. We will discuss more about the type 1 and type 2 nutrient deficiencies in the further questions. Okay. So yeah, here also have given example. Here you can see the type 1 nutrient deficiency. What happens? The child continues to grow in type 1 nutrient deficiency, but the tissue levels of the nutrients falls and specific symptoms arise. So what are the minerals required to combat type 1 deficiency? This list is given here like calcium, copper, fluorine, iodine, iron, manganese, selenium. Also, some vitamins are required to combat this type 1 nutrient deficiency. In type 2 nutrient deficiency, what happens? Child grows slow. Here, child grows, but here the child's growth slows down and the tissue levels of nutrients are maintained, whereas in type 1 it was falling, and there are no specific symptoms for type 2. So, the minerals required to combat type 2 nutrient deficiency are Magnesium, potassium, sodium, and zinc, and also some essential nutrients are given here. You can go through the slides later. Moving on to the next, how much protein is present in 250 ml cow milk? 12 grams, 16 grams, 8 grams, and 20 grams. Where can ma'am to check our assignment results? I'm not sure about that. Like you're asking about the current year assignment results. I'm not sure about that. That's like not under my supervision, so I don't. Uh, Already, you people have submitted week 1 and week 2 assignments. Current year, I'm asking. So after that, it is not showing any marks after you submit, like which is correct and which is wrong. Okay, maybe after the last date is finished, they will show. I think so, as far as I can remember, because tomorrow is the last date, right? So after the last day is gone, also where can I find these videos? The channel has recorded. No, like the playlist is the same, but you can see the template of the video week one. It is written 2025, so that is for week one. The playlist I have not made a different playlist. It is the same playlist, but in that the template which I have used for my new video is different, as well as it is written 2025 in the topic, as well as the some something very big. For the new joinee, can you narrate the course structure, how it works? Do you give the topic and a live? No, it's not like that. So I am repeating once more for whoever have joined first time in the class today. My job is to discuss the previous year assignment questions with you all, and it is related to the lecture you have attended for the particular week. Like today's we are discussing week 2 questions. That means already week 2 lectures are available, right? So you should attend the week 2 lecture and come prepared to the class, so that whatever questions we discuss here, you can answer them. Okay. So this is like a practice session so that you can get exposed to more and more questions. Already you have a set of questions for every particular week which you solve in your current year assignment. Okay. And but before that, before your last date of submission for that particular week, I discuss here previous year questions so that whoever is facing issues in solving those assignments, or whoever wants a revision of the whole lecture again, they can come to this class and we can again go through the topics little by little, right? I hope that is clear with everyone that here we discuss only previous year question paper. I don't have any relation with the exam pattern, registration, etc. So those kind of doubts you can ask in the forum. There is a discussion forum option coming in the NPTEL website. If you go there and ask your doubts, there are people who can answer you. Okay. So let's see, the correct answer is 8 grams. So I think many people have given the correct answer. I could see. So here you can see milk is a dairy product, right? And it contains calcium, protein, and vitamin D as well. So what are the quantities? If we see here, there is 4.6 grams of fat in 1 glass of milk, 8 grams of protein, 12 grams of carbs, 122 calories in total, and 0 grams of fiber. I hope this is clear. We'll move on to the next. A child has severe type 2 nutrient deficiency. Mother increases the quantity of the previously given food without improving the quality of food. Will it help? Start answering yes or no. People who are raising their hands, if you have any doubt, please ask in the chat box. Okay. Yes, I am noting down the attendance and I am reporting it to the NPTEL team. So yes, attendance is compulsory. But if you, in case you are unable to attend the class because of any unavoidable issues, that's why we are recording the class so that you can see it later again. Okay. Yeah. Okay. So let's see what is correct answer for this question. Correct answer is B. No. A child has severe type 2 nutrient deficiency. Mother increases the quantity of the previously given without improving the quality of food. Will it help? So the answer is no. So what happens? Type 2 nutrients result in reduced overall growth. Nutrients with the type 2 deficient individuals with the type 2 deficiency have slow growth, as I told already, stunted growth, and have no symptoms. But they don't have any symptoms, have no visual signs or differences from normal individuals. And mild cases of type 2 nutrient deficiency are characterized by reduced growth. Only on the basis of growth we can say that a child is having type 2 nutrient deficiency or not. And if a mother increases the quantity of the food but they are not increasing the quality of the food, it won't help the child at all. Right? Yeah. Let's move on. Question number 6. Along with folate, which other nutrients are necessary to prevent neural tube defects? Calcium, potassium, choline and omega 3, vitamin B12 and choline. Okay, let's see what is the correct answer to this question. Correct answer is D, vitamin B12 and choline. So here you can see along with folate, which are the other nutrients that are necessary to prevent neural tube defects. These are vitamin B12 is there, riboflavin is there, choline is there, methionine is there, B6 is there, inositol is there, and glycine is also there. So these all are required to prevent neural tube defects, right? Moving on to the next, name two main thyroid hormones. Thyroxine, thyroid stimulating hormone, TSH, triiodothyronine, thyroxine, triiodothyronine, thyroxine, adrenaline. Start answering. Will we also have a preliminary test? No, I think only the assignments which you all are submitting, current year assignments, those are going to carry marks for your final exams. So please make sure you are doing them properly. As well as in your final exam, you will have multiple choice questions as well as subjective questions. So that's why this assignment class is important so that you can practice as many questions as possible, right? Okay, this was a easy question. Let's see what is the correct answer. We'll move a little bit faster. It is thyroxine and triiodothyronine. These are the two main thyroid hormones. Here you can see how the thyroid gland looks like and what are the hormones. It is the TSH, TRH, T3 and T4. So among that the two main hormones are T3 and T4. T3 is the triiodothyronine hormone whereas T4 is the thyroxine hormone. Okay. So the thyroid hormone actually represents the combination of the two main hormones that your thyroid gland releases, thyroxine and triiodothyronine. They are often referred to as the thyroid hormone because T4 is largely inactive, meaning it doesn't impact your cells, whereas T3 is active. So once the thyroid releases T4, certain organs in your body transform it into T3 and then it impacts your cells and your metabolism. So whenever T4 is released, it transforms it into T3. What is T3? It is the triiodothyronine hormone, and then that hormone is the main hormone which regulates your body metabolism. Right? Okay. Going on to the next, deficiency of both selenium and dash together increases the risk of thyroid disease. Choline, calcium, iron, and iodine. Which of the deficiency leads to thyroid disease? We already discussed what are the hormones involved in present in the thyroid gland. So next is the which nutrition deficiency or which mineral deficiency you can say leads to thyroid disease. It's a very common thing. Like in India, majority population suffered through this disease, and yeah, these are the some basic general knowledge questions which we all should know, right? Okay, I think this is an easy answer. Please give your answers quickly. So we'll see what is the correct answer to this question. 82 people are present here. I want 82 answers in the chat box. Okay? Yes, there will be short answer question. Short answer in the sense MCQs, I think. And then there will be subjective. Subjective questions can be many. Can be 2 marks, 3 marks, 4 marks, or 5 marks. It depends on Well, ma'am, who is taking the lectures. She will be only preparing the question paper, not me. Okay. Okay. I think everyone is done. Let's see. The correct answer is iodine. So deficiency of both selenium as well as iodine together increase the risk of thyroid disease. So iodine is present where? Generally in salt. Salt में there is iodine. So who people who eat less salt, like less means much less salt, they also have the risk of having thyroid disease. Also, more salt is not also not advised. So there has to be a balance in everything. So iodine, proper amount of iodine plus proper selenium leads to a healthy thyroid gland, right? Moving on to the next, which of the following are some of the signs of vitamin A deficiency? Back pain, blurred vision, headache, dry skin, anemia, diarrhea, poor immunity, ulcers in the mouth, bleeding gums, pimples, low blood pressure, joint pain. Okay, I hope everyone is done. Let's see what is the answer. We still have 12 more questions. So let's move a little bit faster. The correct answer is B. Dry skin, anemia, and diarrhea. These are some of the signs of vitamin A deficiency. So here you can see signs and symptoms of vitamin A deficiency. It is dryness, itching, redness, night blindness, keratophthalmia, xerophthalmia, dry, rough, itchy skin, dry, brittle hair, loss of acute senses, loss of appetite, anemia, poor growth, low immunity, and increased risk of certain cancers. Moving on to the next, in a type 2 nutrient deficiency, is the appetite affected? Appetite increases, appetite reduces, appetite is not affected, appetite is affected only in a type 1 nutrient deficiency. People who are joining late, please try to be on time from next time. Otherwise, you are missing out on a lot of things. Okay, let's see what is the correct answer. It is B. Appetite reduces. In a type 2 nutrient deficiency, appetite is affected and it reduces. So, the type 2 nutrients are the nutrients whose deficiency leads to reduced growth. Already we discussed that. And due to that, there won't be any symptom, but your appetite will decrease, which will lead to like you will eat less and your body tissue breakdown will be affected as well as your growth will stop. Okay, so this is what it happens. We already discussed about type 2 deficiency. Here are also some of the details given in this slide. You can go through these slides later. Okay, moving on to the next, it is said that we must include complete proteins in our daily diet. Why? They contain all essential amino acids. They contain few essential amino acids. They do not contain any amino acids. They contain all non-essential amino acids. See which is the correct answer. Start answering. People are still joining already. We have finished half of the class. So whoever is late, please try to be on time. Okay, let's see what is the correct answer to this question. It is A. They contain all essential amino acids. So complete proteins are required because they contain all the essential amino acids. So here are some of the animal based and plant based sources of proteins. You can go through these. Okay, moving on to the next. Supplements are commonly recommended to correct dash nutrient deficiencies. Type 1 or type 2. Already we have discussed a lot about the type 1 and type 2. Now I think you should be clear what are the differences between type 1 and type 2. Okay, let's see what is the correct answer. I hope everyone is done answering. So easy question. We have already discussed the concept. It is type 1. So supplements are needed if you want to correct a type 1 nutrient deficiency, because type 1 nutrient deficiency will show us some symptom. There will be some physical sign, and according to that you can check because of the sign which deficiency you are having. Either it can be anemia, iron deficiency, it can be beriberi thiamine deficiency, it can be pellagra niacin deficiency, scurvy, vitamin C deficiency. These all come under type 1 nutrient deficiencies, right? And the micronutrients that, if deficient, lead to the type 1 deficiencies are also given here. Okay, you can go through these. Moving on to the next. Name two selenium rich food sources: chicken, fish, almonds, walnuts, fish, wheat, butter, curd. Start answering. I hope everyone is active throughout the class and everyone is actively participating. And yes, please keep noting down how many correct answers and how many wrong answers you are giving. At last, we will check your score. Okay? Yeah. Start answering. Okay, is everyone done? Okay, let's see what is the correct answer. It is A. Chicken and fish, they both are selenium rich food sources. So, someone who is non vegetarian and they're taking chicken and fish regularly, they will never have selenium deficiency. And what is selenium deficiency lead to? It can lead to thyroid, right? You already understood that. So, here are some of the more sources of selenium rich foods like egg, fish, brown rice, chicken, sunflower seeds, right? Many are there. You can go through this slide. Moving on to the next, it is difficult to determine which specific dash nutrient the body is deficient in. Type 1 or type 2? Already this is a very easy question we have discussed. It should be type 1 or type 2. It is difficult in which deficiency it is difficult to determine which nutrient the body is deficient in. Please read the question properly before answering. I already saw some of the people answering as soon as the question was given without reading it properly. I can realize that. Okay, read the question properly. And 83 people are there. Please try to answer, everyone. Okay, is everyone done? Okay, let's see what is the correct answer to this question. It is type 2. First people have answered type 1 without reading the question properly. Already we discussed that if your body is deficient in type 1, you can know it by the symptoms. Type 1 nutrient deficiencies show you some physical signs, some symptoms, but in type 2 deficiency, what will happen? Only your growth will be slowed down. Other than that, nothing will happen. So it's very difficult to notice if you are having a type 2 nutrient deficiency, right? Please keep your audio mute. Okay, let's not create chaos in the class. Okay, moving on to the next. Highest amount of selenium is present in which gland? Pituitary, thyroid, pineal, and hypothalamus. Start answering. Okay, let's see what is the right answer to this question. People are still trying to join. I don't know why you all are so late. Okay, let's see. The correct answer is thyroid. Already we discussed that selenium and iodine are the two nutrients which are required for your proper functioning of the thyroid gland. Okay, so here are some of the factors which I have listed that they affect the thyroid function. So first of all, the nutrients which are required for proper functioning of the thyroid hormones. Here you can see selenium is there, iron is there, and along with that many others are there. Also the factors that increase the conversion of T4 to T3, right? Those all are written. Then factors that actually this should be decrease. This should be decrease and this is increase. It's written wrong here. Okay. And the factors that inhibit the proper production of thyroid hormones like stress, trauma, infection, some certain medications also have side effects which can affect your thyroid hormone. Okay, okay, please go through the slides and please mark that this will be decrease conversion and this is increase. Okay, moving on to the next. Deficiency of B12 may go undetected in vegetarians. Reason could be their diet is rich in iron, which will improve their strength, their calcium rich diet, which will make their bones stronger, their folate rich diet, which will mask the deficiency symptoms, their diet is rich in vitamin B12 foods. Start answering. Read the question options properly and answer, okay? There is no need of hurry. I think I am giving enough time for each question, right? Yeah. So there is no competition who has to give the answer first, but you should give the correct answer. The class is being recorded and I am also continuously watching who is giving what answer. Okay? Yeah. I guess everyone is done. Let's see what is the correct answer to this question. It is C, their folate rich diet which will mask the deficiency symptoms. So, which vitamin B is folate? Can anyone answer? Which vitamin B is folate? B9. Yes. So, if you are taking a rich diet which has folate in it, B9 in it, then it may be possible that your deficiency due to vitamin B12 may go undetected. Okay. So the reports from NIH, which is National Institute of Health, has shown that large amounts of folic acid, which is B9, can mask the damaging effects of vitamin B12 deficiency. That means the current blood tests may not reveal the actual level of B12. So it becomes little bit difficult to actually detect the correct levels of vitamin B12 because of the folic acid. Furthermore, folic acid can correct anemia caused by vitamin B12 deficiency without correcting the neurological damage that also occurs. So, vitamin B12 deficiency leads to anemia as well as it can also cause neurological damage. So, this folic acid can correct the anemia, but it cannot correct the neurological damage. But if the deficiency goes undetected, you may face severe problems when the neurological damage has become more and then you get detected for it, right? Moving on to the next 17th question. A person has a liver disease. The doctor told him that he will be at a risk of vitamin A deficiency. Why do you think the doctor said so? He won't be able to absorb vitamin A. He will require more vitamin A for the repair of liver. Damaged liver will impair the capacity of the liver to store and release vitamin A. He will excrete more vitamin A. Start answering. Okay, I hope everyone is done. Let's see what is the correct answer to this question. It is C. Damaged liver will impact the capacity of the liver to store and release vitamin A. So, if you have liver disease, this damaged liver can impact the capacity of the liver to release and store vitamin A. So, hence you can have a risk of getting vitamin A deficiency as well. So, here you can see the mechanism. You can go through it. Okay. Moving on to the next. Dash is required for adequate absorption of vitamin A. Protein, vitamin D, vitamin B, fat. Start answering. Already we are going to end the session. Whoever are late, it is not acceptable actually, but if you are late due to genuine reasons, let's say, then please go through the recording of week 2. Okay. Okay, let's see what is the correct answer to this question. It is B, right? Fat is required for adequate absorption of vitamin A. So these are the fat soluble vitamins which include A, D, E and K. So that's why fat is required for adequate absorption of vitamin A. So here the total mechanism is written. Whenever you get free time, please go through the slides once more. I'm not discussing it because I think it is already discussed in the lectures. Okay, so whatever is needed, I'm giving you that information. The extra information is there in the slides. Please go through them later. Okay, moving on to the next, presence of dash is important for the absorption of vitamin B12 in the intestine. Insulin, intrinsic factor, phytates, oxalates. Start answering. Okay, let's see what is the correct answer. It is B, intrinsic factor. So presence of an intrinsic factor is important for the absorption of vitamin B12 in the intestine. If you have already studied before, you must have known that always intrinsic factor comes with the vitamin B12. So it is, what is intrinsic factor actually? It is a glycoprotein which has a molecular weight of around 4,500 Daltons, and this vitamin B12 combines with the intrinsic factor, forming a complex that resists the digestion of the gastrointestinal enzymes. So this complex is observed by the ileum, okay, the part of the small intestine, the part of the large intestine, by pinocytosis, right? Small intestine, sorry. So the vitamin B12 is transported to the liver where it is stored. So finally, what happens after all the processing is done? The vitamin B12 transferred is transported to the liver. So the main factor which is important for absorption of vitamin B12 is intrinsic factor, right? Moving on to the question number 20. Food fortification is used to prevent or treat which nutrient deficiency? Type 1 or type 2? All more two questions are left. People who have raised hands, can I know what is their query so that I can solve it? Okay, let's see what is the correct answer. It is A, type 1 nutrient deficiency. Right? Already we discussed. So, what is fortification? It is the practice of deliberately increasing the content of one or more micronutrients in a food or condiment to improve the nutritional quality of the food supply. As we all know that we can know which deficiency it is in the type 1. So for that it is the food fortification can be done, which is a practice where there are the content of the minerals, micronutrients, that is the vitamins and minerals are increased in the food so that you can combat or treat nutrient deficiency, which is generally type 1. Type 2, the deficiency generally goes undetected, so it is difficult to use this fortification practice for type 2 as well, right? Moving on to the next, dash is the first symptom of vitamin A deficiency. Night blindness, white hot spot, corneal ulcer, keratomalacia. Start answering. Okay, let's see what is the correct answer. It is night blindness. This we have been studying from school yet, that vitamin A deficiency leads to night blindness. Right? Here you can see the other signs of vitamin A deficiency as well, like dry skin, dry eyes, infertility, poor wound healing, acne and breakouts, delayed growth, as well as throat and chest infections can also happen because of vitamin A deficiency. Okay. Okay, moving on to the last question, I guess. The way to diagnose any dash nutrient deficiency is to measure and track the weight, height, and mid upper arm circumference. Type 1, Type 2. Start answering. Yeah, I guess everyone is done. Let's see. The correct answer is B, type 2. The way to diagnose any type 2 nutrient deficiency is to measure the weight, height, and upper arm circumference because it is related to growth. Right? Already we have discussed this. So it is the end of the discussion. Let's see your marks. Whoever wants to share their scores, let's go on. 22. Full marks is 22. How much you got out of 22? Okay, I can see Pratyusha, very good. 20, 21 is also a very good score. 15, Sangavi. I think you need to gear up a little bit, go through the lectures. Okay, maybe some people joined late. So, yeah, that's how you have to suffer if you're joining late. It's better if you can join at 7 to 7:10, 15. I'm waiting till 7:15 for you all so that no one misses out from the first question. Okay? Okay. So it's already 7:36. I think we can disperse. We'll meet again on next Tuesday, 7 to 9 p.m. Okay, the timing is 7 o'clock. So please join by 7:15 max. Okay? Thank you everyone. Good night.